Our moderator is Dr. Nur-Run. She obtained her medical degree from the University of Birmingham, UK in 2001, and she subsequently completed all of her postgraduate training in psychiatry in the UK, initially in Nottingham and later in Leeds. She became a member of the Royal College of Psychiatrists in January 2006 and later a fellow in 2020. She obtained additional academic qualification in Masters of Medical Sciences in Clinical Psychiatry from the University of Nottingham and a postgraduate diploma from University of Leeds. Dr. Nur-Run is a general adult psychiatrist. She joined KBJ Damansara Specialist Hospital in December 2020, working as a consultant psychiatrist. She previously worked in Qatar as a consultant psychiatrist and where she was involved in psychiatric training of other doctors and medical students up until her current post. So over to you, Dr. Nur-Run. Please take the floor. Thank you.
Thank you very much, Datuk Bindi. Good afternoon. Thank you for joining us today. And it's my pleasure to introduce our speaker for today, Dr. Vinogiri Krishnan, or fondly known as Dr. V. Dr. V has ample years of experience in scientific research, and she's actually an epidemiologist in public health in terms of background. She has vast experience in research, with particular focus on public health, mental health, infectious disease. She worked in lots of clients and stakeholders in the past, and started her own research consultancy in 2018, Solving Lab Consultancy. She's a strong researcher and advocate for mental health and mental health well-being. Subsequently, she delved into social media, mainly in terms of Facebook and TikTok, focusing on increasing awareness on public health, mental health, and epidemiology. And this platform is known as Mental Health and I. It was actually covered in Malaysia Kini recently. She's an active member of the National Coalition for Mental Health Wellbeing Working Group, and she's into various mental health projects and research, including mental health literacy, suicide, and that's cover all age and profession. So it's a pleasure to have you today, Dr. V.
Thank you, Dr. Noor. Thank you, Dato, for having me here.
Okay. So I'm quite curious, I can see that you come from a research and epidemiological background. So how do you end up in mental health and develop this passion in this area?
Yeah, thank you for that question. And first of all, I would like to say hello to everyone. Thank you to spend 1 hour with us on your Sunday. I hope to share as much as I can from my own personal experiences and also in regards to my passion. So as per Dr. Noor's question, my field, yes, I'm an epidemiologist. So since I was a kid, I was always very much amazed and, with how scientists from those days, they discover something and then they do something for humanity. So ever since I was a kid, I always wanted to be a scientist in the field of, public health, something that I can contribute back to humanity. So that is why I worked hard. So both my degrees, master's and my first degree, I completed in Malaysia, and then I got a scholarship from US and I left to US. So that's where I got my degree in epidemiology. So how mental health came into the picture is, one, mental health is also part of epidemiology and public health, and passion towards mental health started since I was a kid. To tell you the truth, I always wondered a lot about feelings and emotions and why sometimes people have to restrict their feelings and emotions, because back in school, I was from all-girls school. So, various things happen around you, right? When you're in school, first of all, you're curious, and then you see how some of your friends battle with certain things. And then, I had that feeling, to go and help somebody when they're in need, and it always goes back to their feelings and emotions, something they're battling at home. So I had that urge to go and seek out and ask if you're, are you okay? Would you like to speak to me? So things like this, it started since I was a kid. So it grew along the years. And then when I had the capacity and the ability to put myself into it, I started giving more and more for mental health. Yeah. So that is how I actually started. I would say I started since I was young in regards to helping people. Yeah.
I just wonder what you think, given your scientific background. A lot of people view mental health as, it's all in your head. It's sort of an airy-fairy kind of problem.
Yeah.
So I just wonder, from your scientific background, what do you make of that?
Yes. So this is another thing I would like to talk more about. So it all actually why people, the first and foremost, right? Why people actually thinking like, it's all in your head, and if you can just shut it down if you want. It's because of the upbringing, right? So it starts from home, it starts from the society. And when it comes to Asian countries, mental health, in general, all over the world is still a taboo. It's still been stigmatized. People are still being discriminated for not feeling well in their head. So like, and when it comes to scientific, when we look in the perspective of scientific research, and we have mental illnesses and mental disorders. We have a book, right, created specially. DSM-5 has all the mental illnesses and disorders that you can use that to diagnose, because the symptoms are so specific for each mental illness and mental disorders. But people are not accepting, they're not able to accept that somebody can have a mental illness or can have a mental disorder. We don't have to go so far. Somebody suffering with mental health issues, like we can go back to the three main words that people use, right? Depression, stress, anxiety. These are the words that people usually use. And even to tell somebody that you're depressed, or even to tell somebody you're feeling stressed, people think 10 or 15 times before they can actually express their feeling, because they always have this feeling that, oh no, if I tell this, people are going to think I'm crazy. Oh no, people are going to ask me to go to see a psychologist or psychiatrist, and that's a bad thing, right? People feel like if I go to a psychiatrist is a bad thing, but it's okay for me to go to a doctor to see if I'm not feeling well physically. So yeah, so these are the things that people like us, we're trying to do every day, to break these barricades and taboo, and to tell people, look, there's no difference between mental health and physical health. If you can feel sick physically, then as a human being you can feel sick mentally as well. So what we are going to do to embrace it, or to give that well-being to your mental health. So that is what we have to look into. Yeah.
You're right. There's a lot of stigma
Yeah.
in sort of the areas of mental health. And part of it is lack of understanding and awareness that
Yes.
contribute. And I guess these are the kind of platform that hopefully can break that barrier.
Yes.
Incidentally, the theme for this year is mental health
Yes.
is a universal human rights. So
Yes.
it reflects in terms of the basic need. Mental health as a basic need for everyone.
Yes, definitely.
So could you sort of share what are the common mental health problems in Malaysia, and
Yeah.
a bit more in terms of numbers, if you like?
Yeah, sure. But I just wanted to say that, yeah, and I'm also very grateful that I'm able to do this session with all of you in conjunction with the World Mental Health Day, as you mentioned, right? It's just 2 days from today, 10th of October. So it's nice to actually talk about this. But yeah, in regards to mental health problems, right? When we look in Malaysia, let's just look in Malaysia. And today, I think I just want to talk about everybody, regardless of their age groups, or their ethnicity or religion. You see, when it comes to mental health, when it comes to somebody's thinking and emotions and feelings, everything else is, you shouldn't categorize according to, oh, what gender you are or what ethnicity you come from and things like that. It's just being an individual and a person yourself. You will definitely have battles with your own emotions and issues that you face every time, right? So in Malaysia, if you look in Malaysia, one main thing is like, you see, people have a main issues, I would say, is family problems or family issues, workplace, financial issues. And then we also have to look into all groups of people in Malaysia, right? So you see, like B40 populations, for example, or indigenous populations, or even children, or even people from rural areas. You see, they battle the same thing too, but they're not able to understand what they're going through. That's one, lack of awareness. They don't even know what mental health is, so they don't know how to seek help. And the awareness, they don't have much of it. And then another thing is like, people, when it comes again, like when even generally people like us, like we always feel ashamed. I always would like to say this, right? When somebody has financial issue, right? Like they will not be able to open up. They will not be able to tell somebody, I have financial issues. I am not able to pay my car money for 3 months, because they feel ashamed to talk about it, for example, right? Or house mortgage, because whenever it comes to that, they always feel like, oh no, if I tell people that I have financial issues, they're automatically going to judge me, because it's something made like that for many generations. People have been brought up like that, right? So if you're poor means it's no good. If you have financial crisis means no good. You're not a human being anymore. So if you're a human being, you shouldn't have financial crisis. Or if you're a human being, you shouldn't show your feelings and emotions, right? So in Malaysia, if you look, especially during COVID-19, a lot of mental health problems related to people, it started escalating, especially when they had to stay home, when they lose their source of income and things like that. So in general, I would say people are battling a lot: body shaming, harassment, all sorts of harassment, sexual, verbal, violence, especially gender-based violence. You see that a lot, and not only women get violated, men get violated as well. It's just that it doesn't come out as much. That's another thing I wanted to say. When we talk about violence, yes, a lot of reports, a lot of things that we see reflects on women, but men get abused as well. So it doesn't come out as like as much as what women are facing. I have lots of men or schoolboys who reach out to me and share their issues, that they're really how suicidal they are, how they have attempted suicide and things like that. So yeah, I think that is what I would like to say. Many issues, and yeah, that's the thing, they're not getting enough awareness or help. So I think people like us, we have to play important roles to help and spread awareness, yeah, and provide as much as we can to help people. Yeah.
So psychosocial factors greatly influence one sort of well-being, and I guess if you reflect back in terms of definition of what constitute good mental health, it reflects in terms of well-being from emotional, psychological, and social.
Yeah.
So you can't run away from that stresses.
Yeah.
But you said a lot of young people sort of access or try get in contact with you, presumably through your social media. What do you find are the common triggers that sort of affect one's mental health?
Yes, definitely. I would like to share my own experiences. I know that before I talk about others, I would like to share my own experiences and like how I used to battle with certain issues. Like what I would say was is like when I started my university, right, my first degree and my master's, and then I had to go on with my PhD. Life wasn't easy for me, especially being in a public university. A lot of issues happen, and being away from home, and then you meet new people. And I'm somebody who people sometimes can use this word on me, gullible. I trust people very easily. I always give my fullest to somebody, and I used to have a lot of issues because yeah, this is a world where everybody is not going to be like you. Some people are going to be genuine and some people are not going to be genuine. But being yourself, sometimes it's hard to pretend, right? So I did face a lot of struggle because at that being away from home, and then you away from your good friends, because you have to get separated. So a lot of things, I used to be depressed, especially during my master's, because that was my toughest yet. And then to secure a scholarship to do my PhD, that wasn't easy. So all these own experiences actually helped me to also understand how others are facing. So after I started my social media platform, right, so I decided in 2021, yeah, I think it's 20, yeah, in 2021 I started my social media platforms. I was like, okay, life is, I'm not free. I do have a family, I do have a career, but social media is something where everyone is using nowadays. So this is a platform I can offer. So I started my Facebook page, and then I decided to also start on TikTok, because TikTok is widely used among Malaysians these days. But You know how TikTok is, right? So I thought, okay, I'm going to use TikTok, in a different way, something that not what people are using it for, because I felt at least 1 or 2 views I get is at least it's going out to somebody out there. So, it took some time, it never got many views or shares or whatever, but, I just take everyday time to record myself to talk about specific things or issues, and that is how people started reaching out to me. So you were asking what are the common triggers, like what I've seen, who I've helped. So from young people and also from elderly people and also from middle-aged people, a lot, like, okay, for the young ones, let me talk about the young ones a little bit. A lot of them have relationship issues. We have to understand that they are now living in a very confused era, because the young ones, including children from school, right, 13, as young as 12, 13, they are already having access to TikTok. Those days, they have to key in certain website names to go into certain inappropriate websites, if you all know what I'm talking about. But now, via Instagram and via TikTok itself, fellow adults themselves are doing a lot of inappropriate contents. And when children are assessing this, because they know how to enter TikTok, it's very easy to download the app and just give a fake birthday. Children are so smart these days, and when they go in, they tend to get confused. So a lot of them understand relationship and love in a different way. They feel that they have to do certain things, and that is love, and that is how they get involved in if you look at NHMS data, right, 2022, they recently did publish their findings, and you can see, like, I've been sharing this a lot when I do my talks with teachers, counselors, or even with high school students. Like, they have found, like, like the percentage is so high, like 30 over percent, they have already involved in sexual activities as young as 12 years old, and some of them have more than one partners. But you see, when they come and share with me personally, they feel that they're so burdened. They feel that this, by looking at social media, this is how love is. So a lot of them have relationship problems. A lot of them are suicidal because they cannot share it with their parents, so they need to open up. And sometimes counselors don't have enough time in school. We have to understand that we are lacking counselors in school. It's like in a critical level right now, because when I talk to counselors, that is what's happening. Like, one school, sometimes one counselor, they have to manage like 1,000 to 2,000 children, like, per week. And it's like, not enough. They don't have enough. So that is why they try to bring in people like me into doing talks and workshops, and for me to also share this and get a common, like a few others to them. So young ones, yeah, mainly relationship problem. They're not able to study properly. Broken homes, a lot of broken homes these days. Children and young ones are suffering, and when they grow up into adults, this trauma follows them because it's accumulated. And we're talking about bullying. I would like to also share a little bit. Those who are getting bullied, yes, they are victims, but those who are bullying, they also need help. You see, they also need help, especially when it starts in school. And counselors and teachers should not be punishing them, but they should give them a safe platform and rehabilitate them instead. Like, try to understand why they're becoming bullies in the first place, right? So this is among children. And among adults, we can see family problems, financial problems, and then they are also having problems with relationships, divorce, separations, infidelity. So these are all the problems among the the younger adults. And elderly population, we have also talked about this a lot. Elderly population, they feel hopeless, they feel useless, they feel they're not loved anymore, not able to function anymore. So yeah, these are the common triggers, and this is what we have to look into, actually, to provide a safe space for everyone in general. Sorry, I spoke a lot for this. Yeah.
Not at all. I think it encompasses a wide range of age group, isn't it?
Yeah.
And just reflect in terms of how mental health can affect anybody.
Yeah.
But the NHMS data from 2022 is also quite interesting. I think in terms of I think only a quarter or less than a third of the adolescents feel that their parents is actually aware of what they're doing.
Right. Exactly.
Yes, so that's a disparity, isn't it, in terms of the parents being sort of aware what their children are up to. Okay, so there's lots of things, and you mentioned that they, especially in young people, they can present with suicidal, sort of suicidal thoughts, I presume. And I just wonder, do you have any more sort of information on that side of things?
Yes, yes. I would like to talk a little bit more on suicide today, because a lot of people, okay, let's go back to that whole situation of taboo and being ashamed, right? People do not complete suicide in a day, right? They do not. They actually show indirect, gestures, indirect indicators, even to their parents or to their friends or even in school. But sometimes when people come and tell you that, it's very common. I've seen it myself when people, children or youth or even younger adults come and confide in me. They will tell me that, look, I have actually shared, that I'm not doing so well. I feel like, death is better. But sometimes when they say that to their loved ones, for example, what they get back is, look, don't be stupid, don't be stupid. I mean, like, why are you talking nonsense? Look, this is going to pass, don't think about dying. And then they just shut it down there, put a full stop there. Sometimes children get this from their parents, so that is why it's very heartbreaking. I just wanted to share something like, this. I came across this, I think about 6 months ago. I'm not sure about the time, but I did make a TikTok content about it because the person asked me to actually talk about this. But this is about a 9-year-old girl in Malaysia. Another thing we have to understand, I mean, like, in terms of data, right, whatever we can see is only the reported ones. A lot of things are not coming out. A lot of data is not being revealed by the PDRM or by MOH itself, because they always consider it, it's private. They cannot share so many things. So only what you see is what they report. But so many things, like things that come to me, these are things that are not reported. Like, so for example, this case that I'm talking about is about this 9-year-old girl. She literally wrote a letter to her mom because she was bullied in school and her friends were not being nice to her. And she actually tried to talk about this to her parents, but her parents, you see, when usually it happens when the parents come in, this was shared with me by the girl's uncle, the mom's brother. So whenever children come and tell this, usually the parents will tell, look, this is just small matter. Children sometimes will tease you, just go and make friends with them and it'll be okay. But the thing is, they don't know what is happening in school. They're not really witnessing it. So it's very important to listen and trust, even though sometimes they might exaggerate. The certain things will be real, right? So this girl tried a level best, but at the end, she actually wrote a letter. She left it in the school. She actually jumped in her school, and she actually, yeah, she ended her life that way. And I saw the letter. It broke my heart. I felt sick for about a week because it was so I was so heartbroken, because children's writing, it's just how a kid writes, right? But she was so expressive in that letter, and she even said, sorry mama, I don't want to give you any more trouble, mama, so I'm doing this. So this happens in a daily basis. So among children, I think the NHMS data, they said that suicidal thoughts, it has increased about 9.5% compared to the year before, and suicide attempts, it has increased about 13.1%. And 2021 data shows that 81% in general, among adults, it shows increase. And again, these are only reported ones. So when it comes to suicide, right, it's not a sin nor a crime. It's just a cry for help. You see, people are not able, even children or adults or even elderly ones, they complete suicide because they feel it's better off that way, because the pain is too much and they did not get the help or the love or the attention they needed. Most of them, people who come to me, who have thoughts or who have attempted suicide, they only tell me one thing: I just want to be heard. I just want people to hear me out without judging me. That is all I need. Not somebody to shut me off and say, look, this is stupid, or look, this is going to pass. People grieve differently, right? Every problem is different for an individual. Some people can handle it in a day, some people can handle it in a month. Some people cannot handle breakups. They take a long time, but they need that time. We cannot take that time away from them and said, look, you're being stupid, right? So yeah, this is what I actually wanted to share about suicide. So we have to be very compassionate. We have to show our empathy, and we have to actually feel what they're feeling if we want to help them. Yeah, we can make a difference, because suicide is preventable, actually, if you ask me, at sometimes. Yeah.
And I just wonder, because in terms of, obviously there's a generation thing about social media, right?
Yeah.
I presume people who access your sites are of a certain age group. And the young people, I think it's not just awareness in school. What has impressed me is during this COVID time, in terms of the Ministry of Education increasing the awareness in school at the school level. So I do see a lot of young people in my clinic who are more clued up than their parents. And so I guess in terms of how do you think, I know it's a bit, how do you think you can sort of create that understanding and awareness in that sort of group? I mean, because I think young people are quite savvy in terms of accessing information. But I just wonder, do you have much thoughts in terms of, creating or educating the other population, the adults? Yeah.
Definitely. So, like, if we want to talk about children, for example, right, the parents also need, like, you see, this is what I'm also doing with teachers nowadays, with counselors. So whenever I go for workshops or talks, nowadays I've been doing a lot in schools, especially, in all languages, English, Bahasa, Tamil, depending on the students. The next step, we plan together with the teachers and maybe some.
Sorry, can I request for whoever it is to mute the speaker?
Can you mute that person? Is it possible? Yeah. I'm not sure who's speaking. Okay. All right. Okay. So yeah. So, like, for example, when we talk about this, right? So we also plan workshops and awareness sessions for parents, because a lot of parents don't really know what children are battling these days. And a lot of parents are actually, like, they're busy, right? We totally understand parents are busy. They have to save money for their kids. And most of the children now, they have to use gadgets, not for their own selves, for their own entertainment purposes, but also for school. It's kind of like required nowadays to have a simple tab, or even mobile phones. It's like quite important, because sometimes they have WhatsApp groups, right, within the teachers and them, and all these things are kind of like necessary now. But what parents forget is, just giving them what they need is not enough. They have to be friends. They have to understand that there's a generation gap between them and their children. Whatever they went through as a kid is not going to be the same with what their kid is going through now, because of the era the kid is in and all the exposures around them, right? So it's important. So when we can do programs like this, parents will be more aware. And another thing is, we also have to look into different populations, as you said, like, for example, B40. I worked with the indigenous population for one of my project, a gender-based violence among women. So I actually went to 4 Orang Asli villages, right? And it was so heartbreaking to see, like, the struggle that they're going through. They're already poor, right? They are in poverty. They don't have enough resources to even live their lives daily, but they still understand that they need to send their children to school. They want their children to be better than them in terms of life, education, and future. But when we went there, and when I carried out my research, they didn't even understand that when they go through gender-based violence, from their spouses, or even, it's a sad truth, but I just wanted to share that a lot of loggers, Malaysian loggers, they go and do activity pembalakan, right? So usually the indigenous villages are all around that area where they go and do the activity pembalakan. And it was so heartbreaking to see children, I would say, 15, 16, 17 years old children who are mothers, but they're not married. They were literally raped by the loggers. So if you see the children, right, you can see the mixture. You can see that they don't. So they're so, they don't know how to seek help. They don't know how to fight the rape. They don't even know that it's rape. They feel that they have to do it because the loggers are telling them, look, you do this, I give you money. You do this, I give you food. And then they get pregnant. So we have these medical camps and all this that we go and feel, but this is the situation, in Malaysia. We have so many things to do for people from, if you allow, I can talk the whole day sharing all this, but I think things like this, maybe, if I can share, a lot of people might know things that you don't really read every day or see, right? So yeah, this was 30 years ago, and it's still happening. It's still happening. We are saying that we are so much more advanced, and we are so much more, technologically and financially. Malaysia is doing so much better than 30 years, but people are still struggling daily. Children are still struggling daily. So we need to do so many things. So if only we can work, for all populations, for all age groups, we can make a difference. Yeah. So I yeah.
So
Yeah.
how do you think in terms of how can we help them to seek help to
Yeah.
expand their mental health well-being, and how can sort of reduce that sort of either stigma, or for them have that fear in terms of addressing their mental health issues?
Definitely. It's sad. I'm sadly saying this. It's not a one day thing that you can achieve. It's a lot of work, and I think a lot of people have to play their roles, right? Besides us, I think a lot of role players. We need a lot of them to put in their effort. You see, even NGOs, right? I work with a lot of NGOs, and they don't have enough resources, or they don't have enough money to do more than what they can do. And I think it starts at home. It starts in the school, the society, the community, and awareness is very important. Firstly, they need to know what mental health is. Secondly, they need to know how to embrace their feelings and emotions. They need to know what is dangerous and what is not, what is destroying them and what is pleasure. A lot of people don't know how to differentiate these things, and children, it starts in school. So I'm actually very happy now that I'm able to do a lot of programs and workshop, and I'm trying to do expand this more. You see, like one of my effort for World Mental Health Day this year is I created a poster, I created a banner, like I just posted it in my page. Actually, you can see, and I'm also emailing teachers, and because my contacts, like all the teachers that are working with me, they are also spreading the word. So I'm like telling them, look, let's do this for the children, right? Let's give them awareness. Let's help them, because at least they can grow up safely in this dark world, right? So everyone has to play a role. So sometimes policies need to be made. That is why sometimes when I do my research, I sometimes I get projects and research, right? So we also write up reports and policies based on like the qualitative interviews we do, because when we do qualitative interviews, this is a time where you get to speak to certain groups of people. Currently, I'm doing a work with refugees and asylum seekers. So I'll be working with refugees and asylum seekers, women and men, and women will be able to share about their children as well. And they need help too. Even though they're foreigners, but the children especially, and the women, right? They need there are a lot of sadly to say, a lot of people kill themselves in detention centers. I can share a lot about that too, but yeah, it's happening every day. So I think and we also have to work with specific departments, or like, for example, immigration department, for example, they deal with refugees, so we can carry out workshops with them and spread awareness and how they can help. Police, for example, teachers. So these are the key players who can help those people under their supervision. Yeah.
I just want to someone commented that one of these, in terms of what's priority for the people in terms of perhaps addressing the psychosocial factors such as the poverty,
Yeah.
and then moving on to education and empowering them. I
Yeah.
guess that's the sort of basic needs, and I think you alluded that to
Yeah.
certain group of the population, isn't it?
Yes. Um,
So just wondering, there are obviously limited resources, and you mentioned about how the psychologists at school are overwhelmed uh,
yeah.
by the numbers of students, but what resources are there sort of locally? And I think someone also asked whether the school boards of education actually mandate to have a psychologist in each school. Do you know?
Yeah. So actually, it's a counselor. Each school, they're supposed to have a counselor. But the problem is, right, they are actually in a very critical stage. Like when I recently did a lot of talks with counselors. So there's a group specifically for Indian teachers who are counselors. It's called the Malaysian Tamil Counselors Association. So they're all Indians. So they get together. They're all counselors. So they were sharing, like they have a team, like it's an organization. So they carry out a lot of programs in terms of counseling for children. So they were telling me that nowadays it's just like it's in a very critical stage right now. Like one teacher shared with me that she's been there for 20 over years with another counselor. That means I actually visited their rooms and they actually put a lot of effort to make that room a safe place for the children. But they also need donations. They are not able to set up rooms like this without proper donations, and some schools get it, some don't. And especially in rural areas, they don't even have projectors, they don't even have proper day one, so you can see how they can do that. I mean, they to be able to connect with a child or a student, you need a one-to-one place where they're comfortable, and even that a lot of schools are lacking. So um, counselors is a must in all schools, but it's just that they're not able to manage it anymore because the number of students with problems are a lot these days. So they need more help. That is why sometimes some counselors, they want to go on to KPM, they want to go to the Jabatan, they get invited to go to the Jabatan and work there, but the Kementerian Pendidikan says, no, you can't go now because we are lacking counselors. So if you go to Jabatan and work, there'll be one shortage of counseling teacher now in your school. And so because of that, they can't advance their career too, because they have to work with this. So this is something that's why a lot of counselors who reach out to me to go and give these talks and carry out workshops, they are putting their own initiative and they're trying to get some funds allocated to bring people from outside who are experts in this field to help their children. So just 2 days ago, I carried out mental health session for 200 students, but this was for the Indian students in the school. So I did for separately for the whole school, and then for the Indians there, because sometimes Indian students, they have some different kinds of issues due to their situation and things like that. So the teacher initiated that, and I did that, and all the students, like out of the 200 students, I got at least 180 sheets back of them. I told them, feel free, take your time, write whatever you feel like writing to me and send it to me. I will read one by one, and then like I will, we can continue, like you can seek. And wow, all those things that they shared, so they are desperate for help as well. So yeah.
So, the resources is limited, and as one of our audience commented that there's other sort of pressure in terms of no proper career pathway,
Yeah.
but seeing if someone were to see another person having sort of mental health issue, what can they actually do?
Sorry, who
if
can
if
actually
if you know of someone who's sort of having mental health issue, what can you do as a friend,
yes.
as a family member?
Yes. So this is another thing that I always stress to people, right? Be in the lookout all the time. Like if you see somebody being sad, just don't, like just don't think that they're going to be sad now and they're going to be okay later. Maybe it is, maybe it's a very trivial thing that you're going through and they'll overcome it. But maybe something huge is going on with them, right? A lot of people do that, like even among husbands and wives, a lot of people come to me for that too. Like sometimes the husbands feel like the wives are not actually giving them space to share or to express their feelings, and sometimes because of their other issues, like maybe financial issues, or maybe because of taking care of children and raising them, they also need love and time, right? They also need to be pampered sometimes. And sometimes um, they feel like they're so broken, and when they want to go and open up to their wives, the wives will not have, so that's a communication. It's very important to be there to observe, just to ask, hey, are you okay or not? Why you look like this? That makes a difference, trust me. Rather than you just ignoring and just serving him food or serving her food or buying her something that she likes. I mean, those are materials. They just need time for you to give that space. Same goes to children, same goes to elderly people, right? So it starts from oneself, right? That's it. Like being empathy, And being compassionate is key. And if we ourselves have problems, don't be ashamed. This is something that everybody is ashamed of when they have something triggering their mental health. A lot of females, for example, they feel very ashamed to share that they're having domestic issues, to share that they're not happy with their husbands. They pretend in front. They try to post a lot of things on Facebook, for example, to show that they're happy, but actually they're battling a lot of issues. And they're ashamed to actually seek help. So a lot of, when I was doing this project, right, I connected with a lot of women, not only those who participated in the project, but their connections and their connections. And people, ladies started to reach out to me, and they said, thank you, like, for giving us a space to express. And we just needed that somebody to understand that we're not doing good, and at least we are ashamed. So this has to go. We have to actually create that kind of empowerment towards everyone, to understand that, look, we are human beings. You cannot escape these feelings or battles and issues. Even children face issues. Even babies have issues. They don't know how to ask for food, right? They have to cry. Sometimes parents cannot hear. They have to cry and cry and cry until they get fed, right? That is how they express their feelings of being hungry and frustrated. So everyone will go through this. So you have to embrace it and then seek help. How you want to seek help? You see how you want to do it. Is there somebody you can talk to besides your loved ones or your parents? If you can talk to your teachers or counselors, don't be ashamed. Or you reach out to people in platforms like me, right? Just write to us or email us, or we'll get back to you. At least at that point of time, you'll have somebody to listen. And to help others, yes, you have to be always there, be there, show love, show concern. It makes a difference. And Dr. Noor, somebody asked me a question, I think, about my findings. Can you see it? Oh, what was the main issues the kids were facing from that interview, right? I can answer. Yeah, main issues, I would say, relationship issues, getting confused about, when they are trying to like a boy, or like when they like a girl, they're getting confused. Like boys, a lot of boys, they get confused when they are with the girl. They feel that they have to participate in some intimacy. They have to, and sometimes they tend to ask the girls for sexual relationship, and the girls are torn because the girls feel, a lot of girls actually shared with me. They said, like, some of them called me akka means sister, some of them called me ma'am, doctor. They were saying that, I love the boy is a nice boy, but he's asking me for certain things that I'm not able to give. But what am I supposed to do? Because of this, I cannot study. So things like that. And the second thing is broken home. A lot of them are from broken homes. The family, the parents are separated, or they come and fight in front of them, and that struggle that they're going through. And the third one was over expectations. Parents are expecting so much from their children that is burdening them. One example was this boy. He's very smart and he's very good in his studies, but the parents are pressuring him, like for example, he gets 90, right? 90%, let's say, for his math paper, and the parents are not showing any emotions of being proud of him, but they're asking him, why didn't you get 100%? That kind of things. And then peer pressure, a lot of vaping, a lot of trying to use certain drugs. They are curious, and then they see things on internet again, and then a lot of them believe vaping is safer than cigarettes. So things like that. So so that's why we plan to do more sessions for children, specific sessions. Okay, this is for boys who are confused with the vaping and things like that. So we do specific sessions. These are for girls who might be might be going through sexual abuse. Yeah, so these are some of the things I could share, yeah, from my findings.
Gosh, it's quite sort of all around young people, adult, elderly,
Yeah.
In terms of the need for creating the awareness,
Yeah.
and being able to sort of ask and listen to them,
Yeah.
supporting them. And I guess in terms of, if you want our audience to have one takeaway message from today, what would that be?
One takeaway message. I always speak more than one. But
I
yes,
know.
thank you, doctor. Thank you, Dr. Noor. It's a good thing. Actually, I just wanted to tell everyone this. Embrace your feelings and emotions. Embrace your whole self. Embrace your mental health as much as you care for your physical health. Right? Very simple. You are cooking, and you accidentally sliced your finger a little bit, what do? You immediately wash the wound, you put the antiseptic lotion, and then you put plaster so that your finger is protected. Am I right? So do the same for your heart. If your heart is wounded, you know, make sure you do something to give it that same that same comfort, the same feeling you had when you're trying to take care of your injured finger. So that is what I would like to tell everyone. Embrace everything you feel. Happiness, you can embrace. When people praise you, you can embrace, right? When somebody gifts you something, you embrace it happily. But when something bad happens, don't ignore it. It just gets worse. Embrace it. Cry if you need to cry, shout if you need to shout. You can always do it in your own terms, right? Like last time I used to do that. I mean, even till now, sometimes when I'm so stressed, I'm frustrated, I cry. But of course, not in front of people, but I just go to a place that gives me that comfort, right? Maybe a washroom if I'm in a public place, or maybe I go to my car, or I take a pillow at home, just scream and, do something. It helps. And if you're angry with somebody, you can just tear off papers, throw ice cubes into the sink, do something that doesn't harm yourself or harm others, but you're expressing your feelings. So yeah, I think that is something I would like to tell everybody. Yeah. Sorry, it's more than
No, thank you. You know, I think you've enlightened us and the audience, and I just wonder in the remaining time that we have whether any of the audience have any questions for yourself. There is one question from someone who asked, and how can Rotary members get involved in mental health in the communities? I don't know. Maybe I shall open it up to yourself, but other Rotary members as
Yeah, I
well.
think this is more a Rotary question, right? But I think Datuk Bindi and everyone from each club, they organize a lot of things actually, right? And I think if you have the ability and you think if you have resources, please do a lot of programs where you can reach out to maybe those that are not able, towards the people whose voices are not able to be heard, right? Maybe towards the rural areas, indigenous population, orang asli population. We can maybe that is something Rotary can do. Just have workshops. You can combine with medical camp along with evaluating their emotions and see how you can provide support, give them maybe some numbers where they can call and talk to if they're in need of help. So I think these are some of my suggestions. Yeah, maybe help those who need more help right now, like those groups, right? Maybe yeah, children, poor people, uh, indigenous populations, and even maybe refugees or asylum seekers. They have a lot of NGOs for that. Recently they did have a fest also, I think a refugee fest. So I actually went for the fest and I actually met a lot of refugees here, Somalians, Syrians, a lot of people are here, Afghanistans, Pakistanis, Myanmar, Sri Lanka. So a lot of children need, because some of them are born here, some of them are brought in here. So yeah. Yes, we should also give ourselves tender loving care. Yes, very true, Miss. Yes, I'm not sure if it's Miss or Mr., but yeah, thank you, sis and brother. That's very true. Yes, self-love is very important. Most of the times we love others with all our heart, more than our heart can give. We can love others, but always love yourself also the same way. Yeah, can join.
Someone
Yeah,
suggested me as a volunteer, isn't it, at KPWKM? I'm not
yeah.
sure what it is, but
I think it's the Kementerian Wanita. I think Wanita and children and yeah, they have many. I think recently they started a new ministry also. I think for women and children, if I'm not mistaken. Yeah. It's I think that's how it works. We collaborate with whoever we can, right, Dr. Noor? Even both of us or the three of us. Well, we do whatever we can. I mean, it can be a small gesture, but I always believe even the smallest gesture creates a huge impact. Yeah, for somebody. Yeah.
any other questions from the audience before I call this session to a close?
Yeah. Thank you, everyone who stayed. Yeah. I'm so happy to share.
And I think in terms of for people to
Thank you, sis.
spare their 1 hour and Dr. V being here to share from her experience and knowledge, really appreciate that. I understand the next session is next weekend, same time on a Sunday as well. So thank you, everyone. for joining us, and thank you, Dr. V. I hope sedikit sebanyak we learn something today.
Yeah, thank you, everyone.
Thank you.
Have a, yeah, so we are closing, right? We are closing now?
Yeah,
Oh,
thank
Datos,
you.
yeah.
Thank you
But
so much, Dr. V, Dr. Vinu, and Dr.
thank
Nur-Run
you.
for that fantastic interaction on another interesting topic on mental health. And you really covered a huge range of, ages and situations and conditions. So that was very, very much appreciated. Now, there was
Yes.
a question about how others can help. Um, yes, we have our district action group, or it's now called Rotary Action Group of Mental Health Initiatives. The numbers are in the directory. Do get in touch with them. We have got lots of activities planned. And also for assistance and helplines, we have a huge range of emergency response resource in our website, the National Coalition website. Please check the website out. And we have a link to emergency resources. And we have a lot of specialists who are well versed in any area, from youth to workplace to children to adults to any issue that can provide the assistance. Yeah. And there are many helplines too who can provide a consultation online in different languages: Tamil, Chinese, Bahasa,
Yeah.
and English. So check the website out, ncmw.com.my. Again, thank you so much for being with us here today, this afternoon, and see all of you again next Sunday for another interesting talk.